Starting. All attendees are in listen-only mode.
Good afternoon, and thank you for attending the STN monthly webinar. This session is being recorded so it can be offered as on-demand CE for our members. Your lines are muted, but if you have any questions during today's presentation, please type them into the question queue and they will be addressed at the end of the presentation, time permitting. STN is an accredited provider of continuing nursing education. To claim CE for this session, you must attend the entire session and complete the online evaluation of the presentation. If you are attending this session live, you will receive an email about 1 hour after the event with directions to complete the evaluation. CE certificates will be emailed approximately 7 to 14 days after today's event. If you are viewing this session as on-demand CE, you will be able to download your certificate after completing the quiz and the evaluation. Today's session is interactive and will include polls, so please provide your input when asked. We hope that you gain great value from our educational session. Today's speaker is Karen Macauley. Karen Macauley is the director of the trauma program at Johns Hopkins All Children's Hospital in St. Petersburg, Florida. She has been a trauma program manager for the past 22 years. She was a beta test participant and obtained her TCRN in October of 2015. Please welcome Karen Macauley.
Hello, everyone. I'm very, very excited to be here. Thank you to STN for the opportunity, and congratulations to each and every one of you for your decision to pursue the TCRN. So today's conference is designed to cover a couple of objectives. The first one being, I really want to describe to you the science behind developing a certification exam. So we all know that this is a very important milestone in the life of a trauma professional, both for us individually and how we feel about our trauma profession, as well as for our profession of trauma nurses, because we know that trauma nurses have an amazing skill set. We have an incredible depth of knowledge about the trauma patient, the mechanism, anticipatory knowing what's going to happen or could happen to them, and we change outcomes, mortalities and morbidities every day that we interact with a trauma patient. And yet for many years we were lumped into the emergency center or lumped into the ICU and not standing up for what we believed was really this critical knowledge base that we have. And so let's look at why this exam came to be and how it really gives to the world around us and our colleagues this true meaning of trauma nurse and the skill sets and knowledge that we have. We're going to go over the content areas and the weights of the examination domains. That is, what in the heck do I have to study and how am I prepared to take this test? We're going to talk about some test-taking techniques. We're going to do a couple of practice questions. We're going to look at getting ready for test day and those sorts of things, just to give you this broad base of knowledge about the TCRN. So first of all, I have no disclosures to share with you. So why would a nurse get certified? Well, right now, believe it or not, 1,500 nurses have gotten their TCRN. What an amazing accomplishment for both STN and BCEN, who has put together the examination. Why does it matter if a nurse is certified? Well, it objectively establishes this level of knowledge, competency, requirements, and achievement. It says to someone else, a colleague of ours, we have this base knowledge that every trauma nurse in the world has as their base knowledge, and I'm competent to call myself a trauma nurse. It does these other things that you can see as well. Certainly it promotes professional development and career advancement for us. It provides employers, patients, and peers a recognition or an ability to recognize our knowledge and what it is that we contribute. And I think it, of course, helps build our self-confidence as well. So who can sit for this exam? Well, the requirement from BCEN is that you must hold a current unrestricted registered nurse license in the United States or its territories. A nursing certificate equivalent to a registered nurse in the United States is also acceptable. So that's the minimum requirement to test. So you can be a brand new RN today and take your TCRN exam tomorrow. Now, I can tell you, you're not going to be very successful doing that. Nevertheless, remember the requirement, just that base to get in. What is recommended by BCEN to take your exam is 2 years of trauma nursing experience across the continuum of trauma care. And we're going to talk about that as we look at the domains and what knowledge base you have to have. Because in our past we've thought, oh, is trauma just the emergency center? Is it just resuscitation, or is it greater than that? As we look at this continuum of trauma care, it's going to be very clear that we have a very long road of knowledge base that is pretty deep as well. So that continuum is very long. BCN also recommends that you've taken some kind of trauma-specific coursework. And we're very lucky that STN does a lot of educational programs. Between their annual conference and the monthly webinars, there's a lot of opportunity for our nurses to get continuing education across that continuum of care. So where did the TCRN come? Well, for those of you who have been around it 20-some years as I have been, think from the moment I believed I wanted to be a trauma nurse, the conversation was, I think we need a certification, right? So I came out in nursing school in the late 1980s, and the CCRN was there and the CEN was there, but no trauma-specific certification. No PEDS one either, since I'm from the PEDS hospital. But it was talked about and it was dreamed about and it was brought up in conversation over and over again. Why can't we have a trauma certification? And now here today, we have the trauma nurse certification. So it started out as a dream, as a conversation of an acknowledgement that trauma nurses, again, have an incredible set of skills and knowledge base that are different from our colleagues who we have much in common with, and yet we still stand separately from. It's also an amazing collaboration. So STN is the dreamer, and BCEN is our collaborative partner who said, all right, we can take your dream and we can make this a reality. And that started in about 2014 when we really started to have some serious conversation. All right, can we do this? Are there enough trauma nurses or nurses who describe themselves as trauma who are interested in this certification? And how do we go forward? And I'm pleased to say, as I think most or all of you know, is the beta test came out in October of 2015, and those first 250 testing positions crashed the website in less than 7 minutes. So if you were not right on the ball at the minute that it opened, you did not have an opportunity to take the beta test. And I believe by the time they got the website down, there were close to 500 trauma nurses trying to take that beta test or planning to take that beta test. So a very exciting accomplishment coming right out of the gate for all of us. So I want to talk to you some about here the science, and so I have quite a few slides, but I think it's important for you to know what is the process? How do you decide what questions you're going to ask? How do you know that that's in my knowledge base and I'm supposed to know that? And so this process started again in April of 2014. The very first thing BCEN was they appointed a role delineation study advisory committee. And that was a committee of 9 people in the trauma nurse profession from a wide variety of places, or as wide variety of places as 9 people can be, from their geographic area, their level of responsibility, their educational background, and those sorts of things. These 9 people came together and started to have a conversation. And what they brought into this first meeting were things like, well, what are the job descriptions? What journal articles are out there that talk about the role of the trauma nurse? What kind of performance evaluation tools are used? What kind of tasks do they have? What kind of competencies does a trauma nurse need to have? What kind of jobs do they have? Because lots of us think trauma program manager, and lots of us think staff nurse, but does that cover everyone and all of the roles and all of the places across that continuum that trauma nurses might be working? They brought in some textbooks, and their responsibility was really to develop this examination. What are we testing? How are we testing? How do we decide if you pass? All of those sorts of things. So a very important task for this study advisory committee. So the very first thing they do would have to come out with a definition of what in the heck is a trauma nurse. And so we know, right, we know that the trauma nurse is that resuscitation nurse. It's what we see on ER. It's the blood and the guts and the glory. But we also know that it's the pre-hospital nurse or the flight nurse. and the OR nurse and the ICU nurse and maybe the PACU nurse as well. It's the med-surg nurse. And then when we come out of that daily clinical role, it's the trauma program manager or the performance improvement coordinator, right? It's the injury prevention, or maybe it's the trauma registry nurse that's doing the trauma registry. We're coming across this continuum. What about our rehab nurses that specialize in taking care of trauma patients? Again, so many of us contribute to the day-to-day care of the trauma patient with our goal of changing that mortality and morbidity and giving people the very best outcome they can have and that return to their life at the best they can possibly be. So BCEN and this advisory council came up with the definition you see in front of you. And so I've talked a lot, and so you've probably had a chance to read this, but it's important. Trauma nurses are nurses who possess critical thinking, right? Every moment of what we do, anticipating what next, anticipating what could happen, making sure that we're prepared, helping patients and their families anticipate, what am I going to do next? How am I going to do that? What should I be expecting? Highly developed skills in patient management, right? We know everything is amazingly time sensitive, has to happen right this minute. We have to be totally prepared. We have to have amazing communication skills so that we all know what we're doing in that choreographed resuscitation and care of the patient. And then we know that we're educated. We didn't become trauma nurses straight out of nursing school. I didn't know anything about trauma the first time I stepped in the ICU or the emergency center. I had to learn about that, and I had to be engaged in the, what is it that I need to know? And we know this as well, but we're saying again, across that continuum of care, reintegration back into the life that they had before. So the methodology of developing this exam, look how complex it is. So the very first thing they had to do, or thing to look at, is decide who in the heck is a trauma nurse. So if you're a bedside nurse, you think it's a bedside nurse, or no, it's a bedside nurse. If you're a trauma program manager, you know that it's trauma administration. Been in administration for a long time, but I will tell you, live and breathe, yes, I am an absolute trauma nurse, everything about me. So they needed to decide who is a trauma nurse. And then once we sort of know who, how in the heck are we going to reach them? The next thing was identifying the topics and the tasks. What were we going to ask about? What are those critical things, knowledge-based things or task things, critical thinking things that have to be a part? And after their work, they came up with 62 topics and 104 tasks that we wanted to ask about. And then we went down to the rating scales. So we put those 62 topics, or they, I was not one of them, put the 62 topics and 104 tasks into these domains. And so we're going to talk about them in depth, 7 different domains. And then when the survey went out, we asked the participants, right, the survey participants, to rate them. And so each task or each topic was rated by each individual in a, I don't need to know that. Totally not appropriate, not anything I need to know about, all the way up to that 3, which is it's very important for me to have or me to know in my skill set to be a trauma nurse. Then they determined the relevant demographic variables, so they needed to know this is a national certification, maybe an international certification. So we need to know that it's the base, right, that everybody that passes the exam shows the same base. So we had to make sure, or they, again, we, that's that mouse in my pocket, me and those 9 other people, really had to look and see, are they from different geographic areas? Are there different educational levels? Are they from different levels of trauma center? Do they see different kinds of patients? Again, remember this is a national, international certification, so it means that each and every one of us starts with the same base knowledge. So we had to make sure that that was true. All right, and then they took all of this information, right, is this research at its best, and put it all together, and they sent out a survey to the people that were identified as trauma nurses. So the survey was sent out with the initial response of July 31st, 2014. So look, they started in April, and the survey was put together and ready to go July 31st, 2014. 3,156 people were invited to attend, and I hope that you were, all of you participating in this call were among that, or that your trauma center in a hospital were represented in those email invitations. Quickly, for science reasons, 277 were undeliverable and 20 people opted out of the study. 1,635 people accessed the survey, so a raw response rate of 57%. And then when they completed out that who didn't do any of the questions or who did not complete it, at the end of the day they had 1,328 responses for a response rate of 42%. Considered excellent for this type of study and good data for them to go forward. So remember, the people who got this survey got all of those tasks and all of those skills, and they were asked to rate them from not important in my job, don't need to know that, to up, this is critical and everyone must know this to do baseline care of the trauma patient. And I'm going to share with you here for the next couple of minutes just who responded. Out of those people who responded, this is really important to know. Did we get a good cross-section? Are there the right people that are responding? So you can see in this slide the response rate across the country. So almost every state participated. Pretty equally divided. That Midwest felt a little bit more interested, but not by a ton. Certainly not something that impacted the results. This slide on the left-hand side of your screen shows the highest nursing degree. So a majority of nurses are bachelor's degree with about a fourth in the master's degree and about a fourth in an associate degree with a little bit of other. And then on the right-hand side of your slide, just their highest academic degree. So a little bit of a change. So they might have a master's degree. You can see that one went up a little bit, a master's degree in something other than nursing. And so that gives you just some indicators. So most of us are bachelor's or master's degrees, 3/4 of us in nursing. How long have we been nurses? Well, we've been nurses long times, those of us that participated in that. I think when you think about it, that makes sense. When we decide to specialize in trauma, we've probably been a nurse for a couple of years before we have that opportunity. Many institutions, it takes a couple of years experience, even to be allowed to move yourself over into that title of trauma nurse, depending on the hospital you're in. So some pretty good years of experience. Again, on the left, all years as a nurse, and on the right, years as a trauma nurse. What kind of hospital? Well, I think we're not surprised by this. Lots of community hospitals, which makes sense. And we comprise mostly academic and community hospitals, a little bit of military. We got lots of responses from level 1 trauma centers. Now, when I looked at the data, which is pretty old, by the way, several years old, but just kind of looking at a snapshot to say, well, how many level 1 trauma centers versus level 2 trauma centers out there? There are only about 12% of level 1 trauma centers, 16% of 2s, and then the rest comprise those 3s and 4s, which I think makes sense. I think some of us live in states where there's only one level 1 trauma center in the entire state, supported by a few level 2s, and then the infrastructure of our trauma system are those 3s and 4s. But when we looked at this survey, we had most were trauma centers, although not all. 15% of folks identified themselves as trauma nurses, but were not in current accredited trauma centers. And we got a lot of response, almost 50% from our level 1 trauma centers, which again I think makes sense. In some ways that may be a little, do we have better access to them, or is there different kind of information sharing? And quite frankly, there are just more of them in a level 1 trauma center across that continuum than probably in a smaller level 3 or 4 trauma center. Again, pretty nice split. On the left-hand side is are they urban, are they rural, or are they suburban? So a nice split of that, what we would expect to see. And on the right-hand side of your slide, you see what department they identify themselves as working in. So a very nice mix of trauma service program. They're going to be our trauma program managers, PI coordinators, probably some injury prevention folks buried in there a little bit, against our ED and our ICU, which make up that other little bit more, close to 50%, that are really identifying themselves as the staff nurse. And so when we look at this examination and across that continuum, for those of us that are staff nurses, we're going to probably have to spend a fair amount of time studying that trauma programmatic things that hopefully we've been exposed to but maybe don't know a lot in depth. And if you're a trauma program manager, depending on your role and how much clinical work you're still doing, those performance improvement loop closure questions are going to be second nature to you, and yet are you going to know what you need to know about compartment syndrome or neck injuries because you're not at the clinical bedside doing those things. So where we work is going to help drive how we're going to study for this exam. So there's the science of how it happened. And I think that's important, and I wanted to spend that much time on it because I think it's really important for all of us to understand that this examination came to be, the certification is really science and research based. It's not just a whim. It's not just a couple of people sitting in an office saying, well, I think you should know this or I think you should know that. It really is across the continuum. What is it that trauma nurses believe are critical to their skills and their knowledge and their contribution to the patient? So again, a very scientific build to a test. It's been a fascinating opportunity for me to watch how this has come to be from a conversation across the table and a dream into this true certification examination that we have. So this information is available to you. I know that the links are somewhere here in my presentation. If not, we'll make sure that you get them. This is all public knowledge, so none of this is insider trading or anything like that. But I think it's important for you to know, how did the test break out? And so it breaks out into these 7 domains. And I know you can read it, so I'm not going to spend a ton of time on it. But in the head and neck region, there are 29 questions. And in the head and neck, this does cover all of your traumatic brain injury and spinal cord injuries, as well as your neck, face, and skull fracture heads and those sorts of things. So 29 questions. Now, I know I'm going to answer this later, but I'm going to put it out here to you now. The exam is 150 questions. 150 graded questions are in the exam. So 29 of those questions are going to be about traumatic brain injury, spinal cord injuries, and maxillofacial injuries. The trunk includes the abdomen and the thorax, and that has 36 questions, which I think probably doesn't surprise us, right? Head injury got a ton of space in the exam, and then the trunk, the abdomen, and the chest got a fair amount as well. So again, the trunk, those 36 questions, cover the thorax and the abdomen. Also includes genitourinary, and it does include our pregnant patients that some of us just dread on a daily basis, right? Extremities and wound care, another 25 questions. That includes all of your musculoskeletal trauma, including the compartment syndromes, fractures, soft tissue injuries, and amputations. And it also in there covers all of the burns. And the burns that we're looking at are chemical, electrical, thermal, and inhalation. Special considerations. Okay, what are those things we're thinking about? Interestingly enough, shock got its own space here in special considerations, and I think that probably doesn't surprise us when we think about the mortality and morbidity associated with shock and that early recognition and that quick response to intervention to change the outcomes of these patients. In addition, those psychosocial issues related to trauma. What about family care? What about post-traumatic stress? What about all those issues we have with this immediate crisis for the patient and the family? And then how are they moving back into that reintegration into society? So you've got your shock in there, your SIRS response, your multiple organ system failure is in there as well with those psychosocial issues. 22 questions out of the 150. Now we're going to cover that continuum of care, right? So 21 questions are going to go across that continuum. So regardless of where your clinical area is, your special passion for trauma, you must cover everything from injury prevention through that reintegration back into home through rehabilitation. So this 21 questions is going to cover injury prevention, pre-hospital care, right? Patient safety, patient transfer, forensics, all the end-of-life issues, palliative care, family presence, which we talked about, and psychosocial, and then again this discharge planning and rehabilitation. So we can't forget, we can't think when we've discharged them from the hospital that our continuum is finished. We have to go just a teeny bit further into the how did we reintegrate them through rehabilitation back to their job or in kids' case back to school. Professional issues, very important part of trauma care, right? Certainly we have all of those. Ethical issues that go in there. We have all of our HIPAA and EMTALA and all those things we have to know. We have to know something about the designation and accreditation, verification of the trauma center. We have to know how our trauma center fits into our trauma systems, right? That's a part of that continuum that we need to talk about. In addition, we need to look at performance improvement. And for those of you on the call and a part of this that are trauma program managers, I know you live it and you sleep it and you breathe it and you wake up in the middle of the night and you think about it. Loop closure comes into my personal life sometimes, and I think, okay, did I close the loop? Am I ready to go? But for our clinical staff, not as savvy as we are about that. And so that'll be something that you'll have to look at as you're studying for this exam. Staff safety, workplace violence, a part of that. Disaster management, our everyday life, right? Mass shootings and how we work with our communities. What about the school bus crash? How are we going to manage those things? What do we do about weather and that sort of stuff? Incident stress management. What are we doing with our staff? How are we taking care and recognizing our own staff stress and fatigue and emotional burnout and those kinds of things? Data collection in the trauma registry. Hope each and every one of you knows that you have a very important trauma registry, which is the foundation of how your trauma program works behind the scenes. What's happening in our trauma program? What are the trends? What does the data tell us? What do we have to do to make changes and the outcomes and those sorts of things? What processes need to have change? All comes, or in many cases, comes out of that trauma registry. And then those ethical issues that we know are also a part of trauma care. What are we doing? What are we doing? How are we doing it? So for categories 1 through 4, they're really the clinical issues, right? The neck and the head, the abdomen and the trunk, the special considerations. They then became classified according to the nursing process. And they're distributed the way that it shows here on the slide. So 18% of the questions are on assessment, 31% on analysis, 31% on implementation, and 20% on evaluation. And we're going to talk about those things here briefly when we look at what those things are and what those tasks are. For those last categories, right, that across the continuum, those categories 5 and 6, somehow that doesn't add up to 7, I can see that, but we'll just keep going with that. 21% are recall, 61% apply, right? So I'm going to get the patient condition, and I'm going to decide what I'm going to do first or what I'm going to do next. And then 18% are analysis. So I have this data, what am I supposed to do with it, or what's my next step to do that? Now, again, you'll find this printed out. This is not inside training in any way, insider trading, but these are the testable tasks. When you're looking at assessment, so remember we were looking at those couple of things, how much of that is assessment. So do you get the correct history, right? Do you know what you need for evaluation? Can you figure out a Glasgow coma scale? So you're given what their eye opening is and what their verbal is and what their motor is. Do you know what that Glasgow coma scale is? When you start to look at analysis, right, then you're trying to decide, okay, I have this number, what in the heck am I going to do with it, or what interaction should I be doing first? Looking at analysis, do I know what I'm supposed to do, right? So do I take that data and come up with the right task or the right intervention or the next thing that I need to do? All right, what diagnostic test do I need? Do I need a CAT scan? Do I need a FAST? Do I need an MRI? Do I just need observation? What am I going to do? When am I going to transfer to a higher level of care? Now, if you're a 3 or 4, I know you know this. If you're a 1 or 2, do you know when a level 3 and level 4 want to transfer to you? Do you know what the process is? Do you know what your role in that transfer is? And then, of course, you probably saw at the bottom of each one of these something not otherwise specified, right? That's the job responsibilities not identified in your job description. Always that disclaimer. Implementation. All right, so now what am I going to do? Fair amount of pharmacology questions maybe stuck out on me when I took the exam because I'm a non-clinical person, and so I don't do a lot of giving pharmacology to our patients, and so I was a little surprised, like they were the questions like, oh, I don't know, I'm going to have to think this through and use my critical thinking skills to be able to do that. How am I managing that tension pneumothorax? What am I doing about burn resuscitation? What kind of fluids am I giving? How am I taking care of the burn, right? What about abdominal pressures? What are those numbers? What do I do with them when I see them, right? So now you're given that data and you're trying to decide what are you going to do with it, all right? Implementation. Now here we go, the testable tasks, things you need to know about. So how do I put in a chest tube? How do I manage the chest tube? What data about a chest tube matters to me? What if there's too much? What if there's too little? What if there's bubbles, right? All of those things, when you look at each one of these testable tasks, are the things that you want to know about. So not only how do I put in or what do I do with it, but what does the data mean to me? So when we're studying, when we talk about studying, it's asking those critical questions. It's not necessarily just the task, all right? It's the task and the what do you do with it. When should you put in a chest tube? When you put it in, what are the complications of it, or what do you have to worry about? Again, what information are you getting back, and how are you reacting to that information is all a part of these testing tasks that are going to be done in the examination. So each question will fall in one of those places. It's data or analysis or implementation. But each one of these testable tasks could be asked about. So when you're studying, that's what you want to look about. Immobilization devices. When do you put on, immobilization for a femur fracture? What do you have to worry about? What changed in the patient condition? All things you want to consider as you look at these different tasks. Few more. So this is how do I manage the patients, and I think I probably covered that. Again, not just the task itself, how to do it, and in many cases, by the way, we do not personally do these things, right? But we're anticipating that it needs to get done. We're finding the supplies that they need to have to do the task. We're making sure that it's all put together. We're making sure that the patient's condition has not deteriorated, but in fact has improved because we've done a task. We have to know how to follow those tasks up with our thinking and our knowledge base. Testable tasks, now we're back to evaluation. So now you're evaluating the response to the patient. So you might be given information that you've done something. The test question may be you've done an intervention, and what does that intervention mean? What should you do next? Does it require a second intervention, or for you to change the course of your treatment based on the information you have? Across that continuum of care, what kind of things might they ask about? Well, looking for opportunities across system improvement, right? Are the right patient getting to the right place in the right amount of time to be taken care of by the right team? How is it that we're managing to get the patients back to health? Data, huge. I'm sure we hear this every day of our life, right? Show me the data. Show me the data. Tell me what the data says, right? Let me hear the data, make an intervention, see the data afterwards. We know that it works with our patients every day at the clinical bedside, but it also is how you evaluate your trauma system inside of your hospital and then outside of your hospital across the system, both in your state and nationally. Yeah, small slide here, lots of stuff to look at. The slideshow will be available to you. Again, this is all published data, nothing here that's a surprise to anyone, or should be. You can go and find it. But these are the professional issues. Got to know about ID and hazmat, verification and designation we talked about. What about the family's role in the patient care, the resuscitation? What about the discharge planning? What about language and cultural barriers, which we know are a part? How are you the advocate, right? So you can see in these professional issues, these are things you can expect there to be questions about. All right, so now you know what you have to study. Take a deep breath. Take a deep breath. Don't panic yet. That's what you're thinking you're going to do. We're going to keep on going. So let's talk about this really quickly. So now we know how the test came to be, where it came from, what that dream looked like, what's the science behind it. We know exactly what they're testing on, at least in a broad stroke, high level, right? They've given us all of those topics. They've given us all of those different tasks that we need to understand that have been identified truly by us about things that are critical to our practice and our knowledge base. All right, a collaboration. So I said that it was, and it's a very friendly and amazing collaboration. But let me promise you, without question, there is an absolute firewall. So BCEN, is its own organization, and it shared in the responsibility with STN in the role delineation study, right? The put together of that, the identify the people, the cost of that was all shared between BCEN and STN. But BCEN does all of the test writing, right? They hired their own folks that did all of the test writing. And I can tell you there is a huge firewall. So I do know some of the test writers. They were not, those who were doing it were not a secret. But they have the best sealed lips I have ever seen in my career. Not a word. So of course they've signed a confidentiality agreement. But just from the perspective of ethically, there's no, I'm not going to help you by telling you what's on the test. And so there's this huge, again, firewall. BCEN is responsible for the examination itself, the development of it, the scoring of it, the how does it work. STN has nothing to do with that part of it, the logistics. Owned, the exam is owned by BCEN. STN has no financial stake in the exam in any way. And BCEN does all of the certification management. So the take the test, the get the score, the take the test again if that's what you decide to do, the recertification, all BCEN. STN, as I said, participated in that role delineation study. They do offer, or BCN offers as a part of membership in STN a discount, and we're going to show that here in just a second. And STN has been really instrumental in developing a preparatory course that is available. Now, they are not the only folks that have it, but they do have a very excellent course that's been developed with the disclosure that the development of the preparatory course, the study guides and the information and the tools that are available to practice test taking are done absolutely without question independently of anything about the exam. So STN has the results of the delineation study. They know what the topics are. They know what the tasks are, right? And so their preparatory course covers those things, but it's not covered in a way that it's done to say, well, I know what the question is or I know what they're going to ask. So they are very independent things. Facts about the process. Becoming an STN member is absolutely optional, though there is a discount. The very first thing you're going to do is the online application at BCEN, and then you're going to schedule the test. And I looked at Pearson Professional Centers, and they have just a boatload of test centers available. So I feel pretty confident you're going to find a test center within a reasonable travel distance of your organization or your home. Testing fees available here for you. On the left-hand side are the fees for the STN members, and on the right-hand side, the fees for a non-member. To join STN costs $110, so you can see that it's beneficial. Not only do you get a discount on the examination, but you have access to an incredible wealth of knowledge about trauma nursing across that continuum as part of STN as a member. Questions you might be having about the exam. How many questions? 175. 150 are scored, and 25 questions are in the test phase. Right, so the beta exam, we took more questions. I think I took over 200 when I took the beta exam, and that was to test the questions. So one of the things I laughed about was, my gosh, there were so many questions on abdominal compartment syndrome. And then I thought, well, maybe they asked them in different ways so they could decide which was the best one or which showed the best results. I gave for you that Angoff method just so you know that the passing point, how they decide what's a passing score on the exam, again, very scientific, not just a cutoff, not a 70 or a 75 or a 65. It also doesn't happen on a bell curve. So you are tested against yourself and the knowledge and not how everybody else does. You have 3 hours to take the test. You'll know if you passed right away. And if you do not pass, you can take the test as many times as you want, but there is a 90-day waiting period in between before you can reapply to take the test. So what should you do to prepare? Well, you should practice. We should talk about the obstacles and how to get ready, and we're going to do a couple of those things. While you're preparing, choose a good day to test. Don't test on a Friday if it's always crazy at your house. Don't test on a Monday if it's always hard to come back from the weekend. Look at the certification examination content in depth. Again, available to you through this presentation, available on the website. Again, no secret. Consider a preparatory course, especially if that makes you feel better. STN has one that's live class or online for $225, provides 12 CEUs to you. BCEN also has an opportunity for some practice questions if you choose to go that route. And there are some independent contractors that also have courses that you can look at. It's good to develop a weekly study schedule. Give yourself a timeline. I'd suggest picking a day. When are you going to test so that you're definitely working towards something and not letting it just be too far in the future? Practice. There's an iTunes, Apple.com website available to you, our app, that has just an incredible depth of questions for you. So it will test your knowledge. It will also give you a lot of opportunity to practice taking test questions. Because as you're preparing, it's two things. What's my knowledge, and can I answer the question and answer it correctly? And then what are just my personal test-taking skills? So I can tell you, I did this app over and over and over and over and over and over. I kept doing it, even if I knew the answers. Just how is the question asked and how are the answers framed? I also do Health IQ, which is an app that's offered through our wellness program here at the hospital, and it also has given me some really nice foundational test-taking skills. So even if I'm taking a test on a topic I know nothing about at all, I can still figure out by the way the question is worded and the answers are set, what that answer might be. So a very important skill. So now I'm going to very quickly here turn this over to Cody, and we're going to run through just a couple of practice questions for you. It is a poll, and I hope that you'll participate in it. And let's just see what we get here just for the next couple of minutes, just to give you some idea about what test taking is.
There is a poll on the screen, so if you don't mind to put in your vote, please. Okay, we'll wait a few more seconds to get a few more votes in. Okay, Karen, 75% said flexion, extension, axial loading, rotation, and penetration. That was the most popular by far.
Awesome. Perfect. Let's just go ahead and go through these, Cody, because we don't have a ton of time. Okay. And if people have specific questions afterwards, we'll go ahead and address them individually with folks.
Okay, great. The second poll is now live. So again, please input your vote. Okay, wait a few more seconds. Okay, Karen, 94% picked A. As soon as an indent, patient will exceed resources.
Awesome.
The next poll is now live. Okay, Karen, 92% picked suction the airway and intubate.
Okay.
The next poll is now live. Okay, this voting appears to be a lot closer, so please try to get your votes in soon. All right, Karen, 38% picked B, which was E2, V4, M4 equals 8, and 48% chose E2, V3, M4 equals 9. So that was pretty close.
And really easy. All of us can see how quickly we always have tools that allow us to do that. But when we're pushed to figure out what the Glasgow Coma Scale is, it does require some little bit of thought and a little bit of reminder on how that scale works.
Okay, the next poll is now active. Okay, 100% or 99% picked restoring circulating blood volume and preventing hypoxia.
Excellent.
The next poll is now live. Okay, again, 99% picked B, basilar skull fracture with cerebrospinal fluid leak.
Okay.
The next poll is now live. This one appears to be pretty close as well, so I'll give everybody a few more seconds. So this one was very, very close. 33% picked hypotension, tachycardia, sweating, and pallor. 28% picked hypertension, bradycardia, pallor, and flushing. And then 30% chose hypertension, tachycardia, flushing, and hyperventilation.
Okay.
The next poll is now live. Okay, 82% of the attendees selected patients are at a greater risk the first 2 weeks post-injury.
Okay.
The next poll is now live. Okay, 90% of the people picked visual acuity.
Okay.
The next poll is now live. Okay, this one was close as well. 42% said the left ventricle. 41% said the right ventricle.
Okay.
The next poll is now active. Okay, 88% picked needle decompression. Next poll is now active, and we have about 7 more polls. 8 more.
Let's end after this one.
Okay.
Just so we have enough time to finish up. And just so you guys know, I'm going to get these answers here together for you and send them out to you. Because what I really wanted to use these practice questions for, buried into this presentation, was your personal opportunity to really look at your knowledge base. And when you read the question, did you automatically go to an answer and what that was going to be and those kinds of things. So this is just your personal opportunity to look at the kinds of questions that might be available to you on the exam and how you're going to work your way through them. So for those that were close, we will provide the questions and the answers to you so that you have them. But it really points out, I hope, to many of us how important that app is available to us that we can use for practice, both, again, our test-taking skills as well as our knowledge base.
Thank you. In the last poll, the results are 96% picked assess limb function, perfusion, and neurologic status.
Okay.
Back to you.
So we have, thank you. We have some additional questions available, but I'm going to skip them just because of time, and I want to go over a couple of final things about testing and getting over those obstacles that you have. But again, just highlighting the importance of practice and critical thinking and working your way through a test question and what might those answers be. So real quick here in the last couple of minutes we have, I just want to remind you of the test obstacles, and you probably know what they are, which is probably why you haven't taken the test yet. Maybe it's because you didn't feel like you had enough time in your job. Maybe you've been out of school for a long time and taking tests is scary. And those can all be true things, and I think we all feel them. First and foremost are these mental barriers we have, or obstacles that we think we can't overcome. And so in many ways, an easy answer to several of them, feeling unprepared. Well, now you've got the detailed test content that you can study from. You know what your own personal weaknesses are. Got access to many, many questions so that you can practice, figure out, oh, I know a lot about that, but I don't know so much about that. Just that feeling of incompetence, which I think goes away as you start to feel more self-confident. Taking tests can be scary, scary. Some of us are good at it and some of us are terrible at it, right? And so again, practice tests help us get prepared for that. And that fear of failure always hangs around with us and makes us wonder. And I have to tell you guys, despite my many, many years of trauma program manager and trauma nurse experience, when it came time, I was excited right at the dot of 9 o'clock when I could sign up for the beta exam, I did. But in the back of my head hung the, oh man, there is no way, how are you going to live through not being able to pass the test for whatever reason that is. It's just a bad day, or I just didn't know, or I was unprepared. So that fear of failure hangs with all of us all of the time for sure. Physical obstacles we have to think about. I don't know how many of us get rest between crazy jobs and lots of stress we get from taking care of the kinds of patients we take care of, to our own families and our personal lives. Most of us think if they could add another 8 hours in the day, we might be able to get enough rest. But making sure that we're well rested, that we're eating well, that we really are making a conscious effort to get exercise and be in our best personal health as we can possibly be, will also increase your chances of passing the test. Again, we talked about this a little bit, or I touched on it, just taking the exam at a time that's hard when you have a lot of family concerns or work-related things or financial concerns can be really difficult. The financial ones, especially if you're paying for the exam yourself. I think a lot of us have the luxury of having it paid by our organization if we pass, but most of us do not get it paid for if we do not pass, so that's a huge concern. And I know that many of you do not have any opportunity to have that paid by your organization, and so it really is a personal development opportunity you have for yourself, but it does not come inexpensively as we looked at those costs. Test day gets here, right, whether we're ready or not, because we've signed up for that exam. An important part of getting ready for the test is setting the date and moving forward for it. Don't overstudy. Don't get yourself all psyched out. Make sure you do your best to get a good night's rest. Like I said, don't do it on a Monday after a holiday weekend, or Tuesday, as this case was, because I think we all came into work on Tuesday thinking, wow, I love the day off, but I don't love it this morning when I came into work. Eat a good breakfast or a meal before you go. Make sure you take all the right supplies. Make sure you have your ID, that you have pencils, right, and that you have some scrap paper, even though most of the testing centers will supply that to you. Know how to get there, know where you're going, map it. I know when I took it, I actually drove by it a couple of weeks before just so I knew how long would it take me to get there, where do I go exactly so that I'm not panicked running through the door, unprepared, and have myself all worked up before I take the test. Give yourself plenty of travel time to get there, especially on a crazy day, depending on the hour of the day. While you're taking the test, how long do you have on each question? And the answer to that is about a minute, right? We had 150 questions, right, that were being answered in that 3-hour time frame. So you got those 25 additional questions. So that works out to be about a minute. Some of the questions, you'll read the question, immediately know what you want the answer to be, and you'll find the answer in the answers, and you can move right on. And some will take a little bit more thought. When we listen to the answers on the Glasgow Coma scale, that one might require you to write down some things and work your way through, well, what's the difference between, you know, following commands and not following commands in that score to make sure that you've scored that out correctly. Make sure you follow the directions and that you read each question carefully, right? So if it's an exclude question, you want to make sure that you've seen that it's an exclude, everything but, or which would you pick first, or what is the best answer. So you want to know what each question is asking you. As soon as you read the question, try and get in your head, okay, this is the answer I think I should find. So when you find it, you start to feel more confident. And then you can keep track of the ones you want to go back to. Now remember or know that there is no penalty for answering a question incorrectly, 150 questions. You get so many right or so many wrong. So usually just using your test-taking skills, you can narrow it down to 2, and then you figure it's a 50-50 chance if you're going to make an absolute guess on the question. After the test, when it's all finished, your 180 minutes are up, you've put your pencil down, you've taken your thinking cap off, the very first thing I want you to do is take a huge breath, pat yourself on the back, and congratulate yourself for the bravery to test. It is a hard thing to do. It's a put yourself out there. It's a straight out score. I'm going to pass it or I'm going to fail it. And I don't know how to make fail look better than fail. But be proud of yourself for your decision to go forward and take the certification exam. Celebrate that accomplishment no matter what the final result is. So you're waiting for the test to throw back and you're holding your breath. I want you to take a minute and say to yourself, I did good. I was brave and I came out here and I gave this a chance. And so I'm proud of myself for doing that regardless of what score blinks back at me. If you pass the test, you'll find out right away. You'll receive your card and your certificate within 15 days. Your certification is good for 4 years. You can recertify by test or CEU, either one. What should you do next? Well, notify your employer of your accomplishment. It is a huge accomplishment. Tell your family, tell your friends, post it on social media, tell your employer. I think you should consider a press release as well. It's a huge, important thing for your trauma center. Your nurses and each of you become certified and show that objective baseline knowledge, the care that you offer to your community is really important. You might find your press is interested in that. The other important thing to know is that TCRN is now a magnet recognized certification. So if your hospital is magnet or pursuing magnet, your accomplishment is a huge accomplishment for your organization as well. So you guys, thanks for spending, well, some of you it was the morning because you're on a different time frame, but for those of you on the East Coast here with me, your lunchtime looking at the TCRN exam. Again, I'm really proud of you for looking at the examination and your serious consideration on how you're going to pursue this professional and personal accomplishment. As you can see, I did it. I was scared. I studied a ton. I wondered what it would mean in my position if I didn't pass the test, but I was glad I did it. I was grateful that I passed, with a B, by the way, instead of an A. But had it come out a little bit different, I think I would have been able to look back and say, all right, let me see where I was weak, and let me build that up and do a little bit better. So again, congratulations to each and every one of you for your personal consideration in pursuing this exam. All of the information is available to you that I provided in the show. The links are available in this slideshow, and we will send out the questions and the polling answers to you as well, so that you can use that kind of fun opportunity in this presentation to look at your own baseline knowledge of, okay, so here's what I maybe have to study.
All right, thank you, Karen, for a great presentation. And as a reminder, you can grab this presentation in PDF format in the handout section of the GoToWebinar toolbar. And as a reminder, 1 hour from now, you will receive an email with instructions on how to complete a survey, and that's how you will receive your CE certificate, and that will be emailed within 14 days of today. If you have any questions for Karen, you can send them to me, and I will forward them to her. My email address is C as in Cody, Jones@traumanurses.org. Thank you, and have a great rest of your day.